So you're very welcome, and I do hope you enjoy the day. Our first speaker supports Manchester United, sadly. And like everyone else who does, he said, well, I supported them when they were in the second division. Everybody seems to have to say that, don't they? If he had one wish to wish for in the health and social services that could happen, he thought about it and said he would like everybody to be pulling in the same direction, or everybody singing out of the same hymn book. So something about a common vision would be his wish in the health and social services. He's also Philip McClement's prodigy, because he followed the same path. He was in general practice and then went into the department 19 years ago to the day, and is now the Deputy Chief Medical Officer. So it gives me personally a lot of pleasure, and he's never spoken, I think, at one of our conferences before, so it's lovely that Paddy Woods is going to speak to us first. Paddy.
Thanks very much for that glowing tribute, Robin, and revealing one of my many guilty secrets. Inadvertently, you pointed out the fact that I'm over 26 years of age. But that aside, it is with great personal pleasure that I'm here today to open proceedings, and thank you for the invitation. For various reasons, I haven't had the opportunity to attend a conference for maybe in its lifetime, because it could be some 5 years ago since I previously attended. So it is, as I say, with great pleasure that I take this opportunity. As in previous years, I think the team is to be commended for the array of talent that they've assembled, from which I hope we will all benefit throughout the day. And today's programme constitutes a wonderful opportunity for all of us, I think, to learn from those who are engaged in quality improvement in all its facets, and indeed at all levels. Today we will hear from those who are involved in setting the policy context in which quality improvement sits. We will hear from those, of course, who are engaged in delivering a quality service on a day and daily process. And I think also, critically and quite crucially, we will hear from those who connect those two ends, because at the end of the day, policy without implementation is merely empty rhetoric. And by the same token, those who are engaged in this activity on the ground, without any direction or any support from the wider system, will find that the energy, the enthusiasm and the gifts that they bring to bear will be difficult to sustain, will be sporadic in nature, and almost inevitably will be impossible to bring to bear to other than a limited number of people. And of course, our aim throughout the system, be that at departmental level or in service provision on the ground, has always been to generate and develop services that are continually improving, and that those improvements are delivered to the maximum amount of people that those benefits can be accrued for. The work of GAIN, and indeed its predecessor organisations, has made a significant contribution to that objective. Today, as each of these annual events provides an opportunity to reflect on that contribution and consider how best it will continue to build on the work it has undertaken year on year. The timing of today's conference is very fortuitous or very prescient, in that over recent days we have at last heard the final deliberations on the budget for this year, and certainly indicative budgets for the next 4 years. And there's little doubt that the projected public finances pose a significant challenge for all of us involved in health and indeed social care, in the social care arena. However, I think it's important that we don't merely focus on the financial ends, making financial ends meet, If we do, I think we run the risk of missing the whole point of what it is we're about. And that is largely around meeting public expectations for high quality services. The challenge is far from insignificant, of course, but I think we need to focus and redouble our efforts in driving out the potential for waste or duplication and making sure that services that we commission or provide are not only effective but efficient. Recent announcements around finances, of course, will lead to the temptation, and some will say in many respects already has, the temptation to portray work on quality improvement, such as that of GAIN and analogous organisations, that work is somehow peripheral, marginal, or indeed irrelevant to the delivery of services on the ground. And indeed, the danger is that in the absence of persuasive evidence to the contrary, that those arguments will hold sway. I think all of us in this room certainly do not need persuading of the value and the benefits to be gained from the work that we are all involved in. We would say that they are self-evident, but to a large extent that isn't the point. In the current climate, I think it is incumbent on all of us, like never before, to analyse what we do, determine the value that it adds in terms of the health and social well-being of the population we serve. And increasingly, I think we need to be in a position to demonstrate this quite clearly to that public that we serve. And in many respects, that's code for those that represent the public that we serve. I don't want to sound despondent on the back of that, actually, far from it. I feel that we have many, if not all, the tools that we need to achieve that aim already in our hands. The work of GAIN provides many of those tools. Clinical guidance and the means by which we can assess our practice against that guidance, wherever its source, is the business that GAIN is intimately involved in. And that provides a significant amount of the tools that we require. I think more than ever, those tools will need to be brought to bear on, for want of a better term, the big hitters, the things that impact materially, day to day, on large sections of the population that we serve. Again, we are not short of the tools to identify and address those issues. The growing suite of service frameworks that have been produced over recent years produce a set of standards against which we can monitor and assess how well we are meeting the needs of our population. The soon-to-be published framework on cancer prevention, treatment and care will add to the current suite, which includes cardiovascular and respiratory care, and over the next year or so the suite will be further developed to include that on mental health and learning disability. All of these add to and develop a systematic approach to service provision, the analysis of quality and continual improvement. As I mentioned earlier in my opening remarks, if we rely solely on the energy and enthusiasm of individuals, impact is likely to be marginal. Building on that energy and enthusiasm of individuals through a supportive and productive system that will sustain and build on that energy is what we should be aiming for. Again, I feel like I'm preaching to the converted in that the work of GAIN, to a large extent, has been reliant on individuals and their energy and their commitment. But in many respects, the organisation provides that sustaining and supportive environment in which these activities can thrive. Today's event is actually a very practical and wonderful example of that supportive work. When you look through the programme, all aspects of the quality improvement agenda are covered from a variety of perspectives. I've no doubt that, like me, you're keen to hear from the talent that has been assembled for today's proceedings. I don't want to take up any more of your time. I think it's far more important that you hear from those that know what they're talking about. And like you, I am largely here to hear what is to be said and to learn from it. So it was with great pleasure then that I hand you over to the experts for the remainder of today. Thank you very much.